Hello, and thank you so much for joining us this evening. I'm Sara Gideon, Speaker of the Maine House of Representatives, and also candidate running to represent all of us in the United States Senate. Today is March 31st. In fact, it hasn't even been 3 weeks since Maine had its first positive coronavirus test done. And yet, in the span of that time, so much has changed in all of our lives. The way we work, the way we live, the way we interact with each other all together. And that brings us to what is our third virtual town hall in the number of weeks we've had since we suspended our in-person activities on this U.S. Senate campaign. Now, the reason that we're doing this, even though it is uncharted territory for many or all of us, is because we think it is more important than ever that we remain in communication with each other, that you are hearing from me, but more importantly, that I am hearing from you. Because the reality of this situation and our lives right now comes down to the idea that we cannot forget, that we are in this together, that none of us are alone, and that we will make it through to the other side by making sure that we continue to look out for each other all along the way. Now, that being said, as we have seen more and more cases of COVID-19 across the country, but also here in Maine, more than 300 as of today, we know that we are having our medical personnel, our nurses, our doctors, our emergency first responders on the front line. And we've seen a really worrying trend in this. We've seen the fact that they do not have enough protective equipment in place for themselves. These are the people who are literally on the front lines of the battle with the coronavirus. They're the people who are working not only to keep folks healthy, but in fact to save lives. And we simply must make sure that we have that proper protective equipment for them in place, also known as PPEs. Now, the Trump administration right now has put us in a place where states are being left behind. In fact, it's like we're competing against each other for these incredibly scarce resources. You might have seen over the weekend that the Washington Post reported that Maine has only received 5% of the N95 masks that we ordered. And in fact, Dr. Shaw, the head of the Maine CDC, said just yesterday, I think it was, that we've only received a paltry amount of the number of protective equipment that we've ordered. This is not okay. And when I mentioned just a moment before that states are being forced into the position like we are in Maine, where we're trying to compete with places like New York and California for this gear, not only is it not right, but it means that people will be sick and people will die unnecessarily. We cannot allow that to happen. And I want to be clear, this coronavirus pandemic is a national crisis. And a national crisis means that we need to have a national response with strong leadership at the national level and the federal level. That's why I have continued to call upon the feds and the president to make sure that we are actually producing the PPE we need. Now, the president could implement and invoke the Defense Production Act to make sure that we are producing this protective equipment, just like he has done already with ventilators. And yet it hasn't happened. We know on the positive side of things that Congress came together just last week. It was challenging, but they did come together and they passed legislation that included a number of measures that will help people that are in economic crisis. This is important, but I cannot emphasize that their work is not done, because as long as that PPE is missing, we will continue to have this virus spread at a rate at which we cannot keep up. And not only will it destroy people's health, but it will continue to destroy and undermine our economy as well. Now, on the federal level, we've seen glimpses of really good things happening too. In fact, our own Senator Angus King and Representative Shelley Pingree introduced the Medical Supply Chain Emergency Act. And this piece of legislation would actually compel the president to invoke that Defense Production Act that I was just talking about and to make sure that we are coordinating the production and then the distribution of the PPE to the states that need it. This is what we need to see happen. And I think that when we look at what's happening, even here in the state of Maine, we are setting a great example for what needs to happen on the federal level as well. As you know, in the legislature, Republicans and Democrats and independents came together swiftly to pass legislation dealing with COVID-19. It included appropriating money for the governor to be able to use during this crisis. It included expanding access to healthcare through telehealth, as well as making sure that insurers would provide coverage for testing of COVID-19. It included expanding unemployment benefits. It included making sure that kids and families around this state have access to nutritious meals during this time. We know that Governor Mills and her commissioners, Dr. Shaw, and all the public health officials are working literally around the clock and tirelessly to get resources to everybody in Maine who needs them. And of course, we know that the rest of Mainers, people, individuals, businesses, are doing what Mainers do best, looking out for each other and stepping up to the plate. Whether that is delivering meals to seniors, checking on others, sorting food at the food pantries, delivering groceries, whether that is companies, and there are a number of them that have already made the efforts or started to change their own supply and production lines to produce that very PPE that I've been talking about so much tonight. This is who we are as Mainers, and we set an example that we know the entire country can follow. I just in closing want to say this. This is a time for all of us to come together and to work together. But what we need desperately is leadership at the federal level. We will not get through this crisis unless we have that. And it is essential that we take care of each other and that we take care of the medical health professionals who are on the front lines trying to keep us well, safe, and to save people's lives. I want to thank you so much for tuning in tonight. And next, I am going to turn to Mike, who's sitting 6 feet across the room from me, and who is going to read questions as they pop up in front of him. We're going to get to as many questions as we can tonight, but what I want you to know is if we don't get to your question tonight, we are going to continue to have forums like this where we can be in touch and communicate. I wish you well, stay safe, and take care of each other.
All right, Sarah, our first question is from Karen in Portland, who asks, what do you consider to be the most important message to carry to Maine people in these extraordinary times?
Karen, thanks. I think that is a broad question and yet an incredibly important one. I think that the number one thing that I want to relay to people is something I said earlier tonight, but it cannot be overstated. That is that we are all in this together. This is a national crisis. Well, it's an international crisis that we're dealing with. And the only way that we will make it through is, number one, by following the guidelines that have been set out by the healthcare professionals and the CDC and the governor. By two, making sure that we are checking in on each other and taking care of each other. Number three, by making sure that those of us who are lawmakers or policymakers, whether it's on the state level or on the national and federal level, that we are paying attention to what is happening for individuals and families and businesses, both in terms of our health, but also in terms of our financial and economic well-being, and that we will not stop doing that and making the adjustments that we need to make until everybody is on their feet again.
Andrew from Old Town asks, what are you doing to support our healthcare workers? And Jacqueline added in the comments, how can the federal government increase the supply of medical equipment to this country?
Yes. So thank you both for that question. And this is one of the areas that it is so challenging to be on the state level, knowing that there is not a tremendous amount we can do here, because really what Jacqueline hit on when she asked that secondary question is key for us. We need a coordinated response that comes from the federal level. In fact, that comes from the president. We are too far behind the eight ball here. And whether we are looking at a state like New York, whether we are looking at Michigan, which is has a booming and unfortunately just right behind New York in terms of the number of COVID patients, or whether we're in Maine, we have to have the protective equipment, the personal protective equipment available for medical professionals so they can go to work, so they can test people, so they can treat people, so they can go home to their own families without further spreading that virus, and so that they can stay healthy themselves. It's got to come from the national level. It's got to start with the president. And the number one way he can do it is to implement and invoke the Defense Production Act in terms of PPEs.
Julie from Cumberland asks, with an important election on the horizon, a global pandemic affecting all of us, the need for trusted news sources could not be greater. Where do you turn for information, and where do you suggest your constituents turn?
So this is something that is a vitally important question to all of us. Whether we are looking to the news to understand what the latest guidelines are, whether we just need facts and data about where we are on the curve, or what is happening for our friends and loved ones in other states or around the world. For me personally, I turn to a number of news sources every single day. That includes national news sources like the New York Times and the Washington Post, but it also includes, very importantly, our own news sources closest to home. And here I rely heavily on the Portland Press Herald, the Bangor Daily News, MPBN, Maine Public Broadcasting Network. And I just want to point out that at this time, many of these news outlets are actually making their news coverage free online, which is something that is a challenging economic prospect for them, but they are doing it because it is the right thing to do. So if there is a way that people are interested in supporting them and actually subscribing to those newspapers during this time while you're taking in their news, I want to encourage everyone to do so. That's what we're doing in our family.
Becca asked in the comments, what have you and your team done to help Mainers and local communities stay protected during the pandemic?
Well, Becca, we're actually doing a lot, and I want to just point to my team and my incredible staff here at Team Gideon, who have been out helping sort food at Preble Street. They have been donating blood. I don't know if folks who are watching know this, but blood is in short supply right now, and blood donations and blood drives are in desperate need. I know that some of our folks are out delivering groceries to their neighbors. That's something that I'm doing myself, as well as delivering meals to people in our town. And there are many, many ways that we can participate that include doing those things physically, but also simply picking up the phone and checking on your neighbors, or being in touch and being a point of human contact. And I encourage all of us to do those same things too.
Ava says, I'm worried that the coronavirus will hit poor communities the hardest. What have you done in the legislature to help lift people out of poverty in Maine?
So I'm really, really worried about that too. And I know that all of us, whether it's affecting us individually in this way or people that we know and care about, we are seeing massive amounts of layoffs, of business closures, and there are some businesses that will never be able to open again, and workers who don't know when or where their next paycheck is coming from. We have an unprecedented number of people who are currently filing for unemployment, and those who are already living in poverty are skating really on the edge. We need to make sure, and we see a number of things in place right now, some of which you asked the question of what I have done to lift people out of poverty in the legislature. That has been a main focus of my work over these 8 years, including our LIFT legislation. aimed at lifting families out of deep poverty through a number of ways and then helping them into the workforce and through education and training programs. But look, what we're going to have to do in this time of COVID-19 is going to be much, much deeper and more aggressive. I know that the governor issued some new executive orders today, which will include expanding general assistance. We have expanded unemployment unemployment benefits available to people. Of course, as you know, we absolutely need to make sure that we are being vigilant, that people are not evicted from their homes during this time because of an inability to pay. And there are some steps we've taken, but I think we need to do more, not only to protect people so that they can stay in their homes, but to protect some of the folks who are giving extensions on rent to them as landlords as well. So I think we've got quite a bit of work still to do on this front and many months ahead of us in which we're going to have to stay focused on it.
Thomas writes, I have a simple question about support for our veterans. My brother served in the Marine Corps during the Second World War. I served during the Korean War. My son David served in the Army and retired after 30 years of active duty. One of my grandsons is currently serving in the Navy. On the basis of this experience, I know that one of the most pressing issues for veterans today is getting the help that they need to cope with PTSD. As one of our senators from Maine, how would you work to improve these services for the men and women who have served our country faithfully and well?
So, Thomas, first, I want to thank you and all of your family for your incredible service to our country. I often think that just saying the words thank you will never be adequate enough. It is about, in fact, how we all live, the values that we have as Americans, and how we continue to take care of each other. That being said, you probably know this even better than I do. We have nearly 130,000 veterans in Maine who live in Maine. And we see firsthand, and I've seen through my experience in the legislature, the ways that we can do better in caring for veterans. That's why some of the things that we have focused on have been making sure that we increase programs to reduce the number of veterans who are homeless, to also increase access to mental health care for veterans, and maybe most importantly, to make sure that we are reaching out to veterans who either live in rural areas or who don't necessarily want to be in contact, to making sure that they are getting the services they need. I mention these things that we've done here in Maine because they are the exact same things that I would want to work on the federal level. And you mentioned PTSD. I think when we talk about access to healthcare for veterans, it is incredibly important that we are focusing on and boosting the efforts and the availability of mental health care for veterans in this country. That is something I am 100% dedicated to doing in the U.S. Senate.
Bradley asks in the comments, environmental industries such as agriculture, forestry, and fishing are the backbone for many Maine's residents. How will you address climate change and support Maine's environmental industries as one of Maine's senators?
Yeah. So I love the way you phrased that question because you really brought together all of the aspects of who we are as Mainers, but also who we are as people. What is a crisis to address, which is climate change? It is already upon us, and no matter who we are or where we live in this state, we recognize that climate and our environment and our economy are intricately tied together. That's true whether we think about the industries you mentioned, including logging and fishing and farming, and it's true going even beyond that. When we think about tourism, when we think about recreation, even when we think about the people who come to Maine to do things like hunt moose and the number of moose that are affected by tick-borne diseases. So what we have to do is to make sure that we are fighting climate change. This is something that has to be done on a national level for us to be effective. And yet in the absence of leadership on this on the federal level over the past 3 years, as states, we've been forced to take the lead. Here in Maine, what we have done is set very aggressive goals to combat climate change. That includes reducing dirty carbon emissions and also increasing renewable energy generation. But on the federal level, we need to do this and more. We need to rejoin the Paris Climate Accord, and we need to think, in fact, about what our entire infrastructure is in our states and in this country, whether it's our transportation infrastructure and how we modernize it, whether it's the fleet of cars and trucks that we use and how we modernize that, whether it's our energy infrastructure and how we make the space for more renewable energy to come online and to reduce the dirty carbon emissions, whether it's in transportation or the energy industry. Again, like you said, all of our livelihoods and our future are dependent on this. And whether it's the Gulf of Maine, the second fastest warming body of ocean in this entire world that sees an entire aquaculture changing, or whether it is farming and drought and other things that come upon us, it's vitally important that we do this.
Bob and Leslie from Machias wrote in and said, what is the possibility of expanding access to high-speed internet so that it's more commonly available like water and electricity?
Yes. So your question and the way you ask it really hits the nail on the head, because in fact, our digital infrastructure and broadband is a utility just in the same way that we used to only think of things like electricity and water and basics like that. If we want to exist in the modern world, and I and others have been saying this for years, then we have to modernize our digital infrastructure and our broadband infrastructure, especially in a rural state like Maine. And of course, you in Washington County probably understand this better than almost anybody in the entire state. Now, we are here in this place of COVID-19, and suddenly we are all forced not just to work from home, but to learn from home. We know that there are students in certain parts of this state, and in Washington County, this is definitely true, that don't even have access to broadband at their homes in order to continue their learning. If there is any way that a crisis could help us understand the investment that we need to make in ourselves, this is it. And broadband is an absolute way that we have to do it. Now, I want to say that on the good news side of things, just before we adjourn the legislature, part of the emergency supplemental budget and bills that we passed included sending a bond to the voters in June for $15 million of investment in broadband infrastructure in the state of Maine. But I also want to be clear that that is not enough. That is a long-term solution that still needs more investment. But in the short term, even while we're experiencing this crisis, both the spring and summer and next fall and winter, we have to make sure that families and children have access to high-speed internet. And there are some creative solutions that we're looking at to do that. So stay tuned.
Donald from Vinyl Haven asks, what have been some of your accomplishments in the Maine House?
Well, during my 8 years in the Maine House, it's hard to believe those years are coming to an end now. We have had some very busy years, some of the most challenging years in some ways of divided government and disagreement, and also some of the most fruitful ways to make a difference for Maine people. You know, the things I'm most proud of when I look back are how we actually improve the lives of people around us and lift each other up. I mentioned the LIFT legislation that I've worked on, which is incredibly important to me and to all of us in a state like Maine, where we know we have a high degree of poverty and deep poverty. And let's be honest, it's not just about the individuals who are living in poverty, but it's about all of us and our communities and who we are and how well we do when we lift people up and out of poverty. In addition to that, we faced some of our greatest challenges head on and started to make headway. That includes combating the opioid epidemic and making sure that we are conducting education and prevention, but also treatment that is not just short term, but that understands that opioid substance abuse is something that goes into a person's future and that they continue to need help with. We've made great strides in setting up Maine as a leader and setting Maine as an example for how to combat climate change. And most recently, in the past 2 years, we have worked incredibly hard to increase access to healthcare for people in Maine and to lower the cost of healthcare for people in Maine. That includes passing legislation last year in 2019 so that no matter what happens in the United States Congress or federal court to the Affordable Care Act, people with pre-existing conditions will always know that a health insurance company cannot deny them coverage. Because of it, our own children will be able to stay on their health insurance until they're 26. We also passed legislation just a couple of weeks ago capping the copay for the cost of insulin at $35 a month. We know with a number of people in Maine who have type 1 diabetes that this is an incredibly relevant and important and in fact life-saving issue, and we're going to continue to do exactly that kind of work for Maine people.
Brian in Bar Harbor asks, what experience from leading the state legislature's Democratic caucus do you think you will find most valuable in building coalitions to move policy in the Senate?
Yeah, so this is something I think about all the time, both because in the state of Maine, as I referenced just a moment ago, I think we experienced some of our most challenging years of divided government here in the state. And in fact, my first 2 years as speaker were Paul LePage's last 2 years as governor. We had a Republican-controlled Senate, a Democratic-controlled House, and I really built my understanding of what being a leader means and doing it in action based on that and the challenges of bringing people together every single day. Whether it was those years, whether it's been these past 2 years with a Democratic governor and Democratic House and Senate, when we have worked hard with our Republican counterparts to have agreement, to have bipartisan budget and buy-in on the major pieces of legislation and the budgets that we've produced, it is essential that we work together and that we always remember something that I think about every day, which is that we are all human beings who want to do well and who want to lift each other up. I believe at the end of the day, we have the same goals. We just have very different ideas about how to get there. And one of the things I ask myself to do every time I go into a conversation with someone or find myself in disagreement with someone is to ask myself, what is the other person looking for? What do they care about? What are they most afraid of? What are their goals? And I find that when I ask myself those questions, we are able to come and get there together. That's the kind of leader I've been in the Maine legislature, and that's the exact kind of leader that I will be in the United States Senate as well.
Bill says in the comments, I'm concerned about the influence of money in our politics. What would you do to fix that?
Well, Bill, this is something I'm really concerned about too. And in fact, I think most Americans recognize as a major problem and something that we need to address immediately. Because no matter what other bigger policy issues we're talking about, whether it's healthcare, whether it's climate change, whether it's the cost of prescription drugs, what we have to recognize is the reason why the United States Congress is not getting work done can be traced back to the fact that in America today, corporations seem to have a bigger voice than people do. Not only is that not right, but we will not continue to make progress as Americans or as Mainers as long as that is the case. That's why I support overturning Citizens United, which gave corporations that larger voice than people do. It's why I also support legislation like the Disclose Act that's in fact in the United States Congress today. It's been voted on before. Senator Susan Collins was actually the deciding vote against that piece of legislation. And do you know what that legislation would have done? It would have created total transparency so that when dark money ads are run, we could all see exactly who's behind them and who's paying for them. These are the kind of things and changes that we need to enact on the federal level, and the time for it is now.
Anne in Cape Elizabeth asks, after we get through the COVID-19 pandemic, what would you do to improve access to healthcare for everyone in our country?
Well, Anne, this is the fundamental question that people have been asking, I think, for years. And certainly during the course of this campaign, about nearly 9 months now, we have heard from people every single place we go in this state that this is the number one concern we have. whether it's the cost of healthcare or whether it is simply just access to healthcare in a place like Maine, where rural hospitals are often operating on just a 2-week margin. We need to make sure that every person in this country, no matter who they are, can afford healthcare, and that healthcare is excellent. I think the first step to doing that is making Medicare a program that anybody and everybody can buy into if they choose to do it. I think that right now we also need to keep private insurance as an option for those people who want to keep it. In addition to that, we have to look at how we can lower the cost of prescription drugs. And I'll tell you, there are easy to identify ways that we can do that I'm puzzled that the United States Congress has not actually gone after yet. Whether we're thinking about Medicare and the fact that right now the federal government is not able to negotiate with drug companies to lower the cost of prescription drugs through Medicare. If we did this, not only would it lower the cost of prescription drugs for seniors, but in fact, it would have the effect of lowering the cost of prescription drugs, one of the leading indicators and drivers for high healthcare costs in this country. It would lower the cost for everyone. So those are just some of the ideas that I have, and I look forward to working on.
In Portland asks, what will you do to guarantee healthcare access for women in this time of severely restricted access?
Well, Elizabeth, this is actually something that I have worked incredibly hard on in my year in the legislature, both in years of being in a defensive posture, making sure that we are protecting a woman's access to reproductive health care, but most recently and notably in the past 2 years, even as we have seen on a national level, a worry about what's going to happen to Roe versus Wade, and state by state, we've seen a real attack on women's reproductive health care and reproductive rights. Here in Maine, we actually strengthened and protected a woman's access to health care. And we did it in ways that I think are particularly important and relevant right now. Because one of the things we did was we said that no matter what kind of insurance someone has, that insurance has to pay for an abortion when a woman has one. And this is particularly important when we're talking about not just private insurance, but also public insurance as well. But additionally, we did something which was fix an antiquated law. Now, previously, only physicians could provide an abortion when a woman needed to have one. But what we did was change the law last year to say that an advanced clinician practitioner who was able and trained could also perform these services. This would have been important anyways in a state like Maine, where access to rural health care is more challenging. But now during the time of COVID-19 and with the increased lack of availability of healthcare professionals, this becomes an even more vitally important aspect of how we make sure that women's reproductive health care is there for us.
We only have time for a couple more questions. So the first is, what do you like to do when you're not serving the public in the legislature?
Oh, well, I like to campaign for U.S. Senate, and no, I'm kidding. Well, I'm not kidding. I actually love this campaign for U.S. Senate because it allows me to be everywhere in our beautiful state, continuing to learn about all of us and what is happening in our lives, and to think about how we can keep doing better and keep improving the lives of people around us. But aside from those two jobs, I love spending time with my family. Like you probably, I cherish every moment with our growing kids, Julian, Alec, and Josie, who are in high school and middle school now. I love spending time out walking, running, or hiking with our dog, Jacoby. I love to read, although that is probably the hardest thing to make time for, and to do pretty much anything outside, including being out on the water, swimming, and paddling our kayak as well.
And our last question comes from Terry in Portland. What is the issue that you feel the most passion for?
Terry, there are Sometimes it's hard to answer that question because there are a lot of issues that I feel really passionate about. I think that COVID-19 has brought to light for me that one of the issues that two issues that I talk about the most and hear about the most on the campaign trail is healthcare, that it is just vitally important, that it is a basic human right that we should have access to and be able to afford. But when we see a pandemic, a global pandemic like COVID-19 in front of us, and we see the fact that people are in these emergency situations because of the virus, but also underlying conditions that exist or come up, it just really, again, reminds me how important it is. And I'm so grateful we've been able to do the work that we have on healthcare, but I also know that we have so far to go and that we have to reaffirm our commitment to it. That being said, because I can't just stop at one, climate change has been for as long as I have been in the state legislature and will continue to be an issue that I know is an emergency issue for us that we have to address, and to address before it's too late. I think the coronavirus is a lesson for all of us. We talked about the possibility of a pandemic for decades, and yet here we are unprepared for it. We could have been and we should have been more prepared. And when I think about an issue like climate change, I think that is a lesson for us to learn and to really pay attention to as we emerge from COVID-19.
That was our last question. We have just a few minutes left.
So I want to thank all of you again for joining us this evening. It's starting to, I can see the sun is starting to set outside. It was a beautiful day here in Maine, but we know that we have long, long weeks ahead of us. We have weeks where we are waiting for COVID-19 to peak, where there is a tremendous amount of uncertainty about what that means for our health, for our own health, for our family, for our loved ones. It brings with it a great deal of anxiety, both in terms of healthcare and our own health, but also in terms of the financial and economic consequences that some of us are facing immediately and that some of us worry about continuing to roll out in front of us. It's all very, very serious. And the only thing that I know about how we're going to do this is that we're going to get through it by working together. It's going to take leadership at every single level of government. It's going to take leadership among us in our communities. It's going to require us to bring out the very best in ourselves, even when it is the hardest. But I know and I believe that we can do it. And that is why I will keep on saying what I started with tonight, that we're all in this together. And every time it gets hard, that's what we have to remind ourselves of. So I will see you again, I hope, in this forum. And in the meantime, I wish you the very best. Stay safe, stay well, stay healthy, and take care of each other. Thanks so much.